remain unsolved and unresolved. For a fair and balanced debate on the prospects for a final health care bill, Democratic Congressman Joe Sestak, member of the House Armed Services Committee and candidate for Senate in Pennsylvania, and Congressman Trent Franks, Republican of Arizona and member of the GOP Steady Committee, join us now. Thank you, gentlemen, for coming in.
Thank you.
Good to be here. Happy New Year.
Happy New Year to you both. Congressman Sestak, you wrote a letter to House Speaker Nancy Pelosi, and it basically states what the Senate bill lacks compared to the legislation that you worked to pass in the House. So I want to put up some of the health care's pros versus the cons. You can tell me which you think are a pro or a con, and let us know the following key areas that you feel need to be improved upon. Insurers have to take all patients, meaning that they can't turn you down for a pre-existing condition or cut you off after you get sick. That's a pro, right?
Absolutely, and both the House and Senate have it. Good.
Okay, and Congressman Franks, would you consider that a good thing?
Well, it's something that can be distorted quite easily. If everyone that applies for insurance is guaranteed to get it, then a lot of the young people are going to simply say, well, we'll just pay the fine, and then if we get sick, then we'll join the system. And it has the potential mechanically and mathematically to break the system down entirely. We've always put pre-existing conditions in different pools to try to prevent that. But there are some good things about that. It's just that the trouble, Julie, is that with the differences of the bill, primarily the Senate bill is still a government-run takeover of health care. It still robs Medicare of about $500 billion, and this one, unlike the health bill in the House, forces taxpayers to pay for the killing of unborn children, and that is not health care, and the American people overwhelmingly reject it. But it seems that Nancy Pelosi and Harry Reid are hell-bent on shoving this government-run health care system down the American people's throat. And I can only say to you that if they keep it up, the American people may turn this whole administration and the Democrat majority into one giant shovel-ready project.
I want to talk about, Congressman Sestak, I want to give you a chance to respond to the abortion restrictions because, you know, Harry Reid sacrificed the public option to keep Senator Joe Lieberman on board. He also tightened the bill's abortion restrictions to reel in Senator Ben Nelson on the federally funded abortion measure. That's still not making Republicans happy. Is there any room here for a negotiation?
Julie, let me take a moment out, though, and first say that this House bill that we pass is not government-run. We know right now we have an insurance-run type of monopoly in 94% of all our health insurance markets throughout America. How over the past 8 years, if I might, Julie, just because of the time that gentleman, Trent, my good friend, had, and actually we had the insurance companies between the doctor and the patients denying those who had pre-existing conditions like my 8-year-old daughter with brain cancer that she'll never be able to get health care on her own. So what we do is say it's a mandate that you cannot deny health insurance to anyone with a pre-existing condition. Second, which is very important, Julie, is what we also do is say, you know, we're going to put a competitor out there. We can't abide these monopolies who dictate prices to everyone. In Pennsylvania, 70% of all health care plans actually are owned by 2 companies. It's a monopoly. So we put a public option, which is a choice. It's not funded by the government. Live or die by those who decide to join it to give fair competition to others. Now, with regard to your question on abortion, I'm a strong supporter of the Hyde Amendment, and that's what we had in the House bill before the Stuback-Pitts Amendment passed, which said that those individuals who decide to have a choice that they would like the option of an abortion, we say that their monies, only their private money, segregated, those premiums that they pay can ever be used for that, not federal funding. We had a fair compromise, and that's what we have to get back to, the Hyde Amendment. This health care bill that we have is actually going to, after 10 years, when my opponent in the Senate race, Arlen Specter, actually derailed the Clinton health care plan, has allowed 10 million Americans to lose their health insurance. That's unacceptable, and we have to change that.
We are running out of time here. I just want to throw up the other pros and cons, and then Congressman Franks, I'd like you to respond. Cost-containing measures, that's supposed to be a pro grow, according to Democrats, within a few broad classes. Everyone gets charged the same amount for insurance. Mandatory health care, let's put them back up, would require everyone who has health insurance on the progressive upside. A mandate would bring down costs and share risks more equitably. However, with a public option, it means forcing people to buy the insurance company's product, whether you like it or not. Low and middle income work subsidies, limits on ER charges to low-income, uninsured emergency patients, out-of-pocket expense caps, Medicaid expansion. Congressman Franks, a lot of stuff there that looks great. Question for you is, are the American people buying the Democrats' promises like the ones that Congressman Sestak just pointed out?
Well, the polls show overwhelmingly that they're not, because the American people understand that when you replace free enterprise with a socialist system, that it always costs more. In fact, I will just say this: if indeed the Democrats lower health care costs under this socialist government-run system, it will be a first in the history of mankind. And the only reason that they even get some of the CBO numbers that they get is because they robbed Medicare of $500 billion. And people aren't buying it, and I just hope that somehow Ben Nelson and some of the people in the Senate, when this goes back to the Senate, I hope it does, will find their conscience again and reject this while there's still time.
Congressman Sestak, I'll let you get the final word. You got 20 seconds.
Absolutely. The great things we have is that seniors or even family members, young men and women, no longer have to do co-pays when they go in for the health insurance. So they come for preventive care.